A three-member committee set up to investigate the incident that occurred on the 13th of April at the Tamale Teaching Hospital, which resulted in the death of a patient, have submitted the report to the health minister after months of investigation. Now, you recall that incident months back resulted in an altercation between the Minister for Health and a worker at the hospital, which also coincidentally led to the sacking of the hospital's CEO. The sector minister, Kwabena Minta Akando, received a 39-page report and promised to look through and receive the recommendations. Sarah Penkro is joining us with details from that report presentation in the last hour or so. Sarah, I appreciate your time this afternoon, but what else do we know about this report?
When you rightly said, the report, the 3-page document was submitted by the committee chair in person of Dr. Abdul Rahim Mohammed to the minister. We have not been told the content of the report yet. The minister said he was going to look through the document and look at the recommendations that have been made for him to take any actions needed. So as it stands, the report was presented by the committee members. He received it, and they are yet to tell us the content of the report. Indeed, today, the minister was actually expected to receive 2 reports, actually, one on the Tamale Teaching Hospital incident as well as that of the Ridge Hospital incident. But as it stands now, today, we only witnessed that of the Tamale Teaching Hospital, and we are expecting the Ridge Hospital one to be done hopefully tomorrow, so we know what is expected of the ministry to do in respect to these 2 incidents that happened at the health facilities.
I see. Now, for those who may have forgotten what happened in the case of Tamale, remind us, what was it about?
So you will recall it was the death of a 31-year-old patient who reports suggested it was due to medical negligence at a health facility. This incident, if you will recall, the minister visited the facility in April and had some confrontation with the healthcare workers who were then there, who attended to the patients, while the patient's family also reported some incidents at the facility to the hospital. You would also recall that in the events of this incident, coincidentally, the CEO of the Tamale Teaching Hospital was relieved of his post, which resulted in some of the medical doctors going on an industrial action demanding that they should be respected, and that how the minister handled the issue was not right. So all these incidents have been captured in the report according to the committee chairman. He said they spoke to patients, they spoke to families, they spoke to a lot of stakeholders, and they took 2 months to put together this particular report in the 39-page documents that have been handed over to the minister today.
Let's take a listen to the committee chairman.
Honorable Minister of Health initiated an independent investigation appointing a multidisciplinary committee to assess the clinical, operational, and systemic factors that may have contributed to the death of the above-named patient. So in doing so, the committee actually met. We had a total of about 12 sittings where we met with the family of the patient, the relatives, the friends, staff of the hospital who were actually within this unit. We are talking about the accident emergency department, the ICU, and other staff who mattered in this issue. So within the period of May, June, we were able to meet all of them. And then, of course, we also assessed the protocol, the SOPs, standard operating procedures that the hospital had. And on that basis, we came out with our findings. And in addition to the findings, we also came out with far-reaching recommendations that we think that if these recommendations are actually implemented, will only go a long way to help improve the